Hello, this is Judy McNamee, founder and ADHD coach of ADHD Coach Connect, and we have a fabulous guest today to wrap up our inaugural 2015 Telesummit, Why Is My Kid Struggling? A Parent's Guide to Embracing the New Normal. So we're going to finish up this week with Dr. Kelly Sears. We're excited to have her with us. She's a nationally certified school psychologist and a recipient of the prestigious 2012 Best Practice Award in School Psychology. And I know, Kelly, you earned your PhD from The Ohio State University and are duly licensed through the Ohio Board of Psychology and also the Ohio Department of Education. And a lot of your work is focused on facilitating hope in children, exposing, reducing, and eliminating those barriers to learning. So we love that you've spent many years working with children and families that are battling autism. And I know recently you've gone from your years of service in the public schools to now joining two other professionals and establishing Navigating Autism Plus. And this is a company that provides private, multidisciplinary psychoeducational evaluations and related services to children with special needs. So we're thrilled to have you today. Thank you so much for taking time out of your day to join us.
Oh, it is my pleasure to be here this morning, Judy, so thank you so much for having me.
Absolutely. So I know today, I know we've got a lot of parents that were interested in this. You're going to reveal kind of the 5 secrets to successfully navigating that, special educational maze that we know is such a convoluted process, and that every parent hopefully should know, but often the schools won't tell. So we're very excited about this. I know you also have a bonus to a free download, and we'll provide that to parents down the road. So let's start off and jump right in and talk to us, Kelly, about what a parent with their child with autism, what do they do? Where do they struggle, and what do they do to start that navigation of those murky waters?
Well, yes. The special education process can be so overwhelming oftentimes for parents. And when we have children with disabilities, there's already plenty in life to be overwhelmed about. And so I'd like to just give some insight today about how to kind of get those services that you're looking for, that you need. And honestly, it all starts in the school setting with special education services. Mm-hmm. And so when we're talking about that, it is guided by the Individuals with Disabilities Education Act. And in our world, we call that IDEA, that particular law. And it is the federal law that governs how states and public agencies provide early intervention, special education, and related services. And so the first thing that parents should be aware of is that the federal law actually mandates that the school districts do what's called this process called child find. And child find is the process where they are actually required by federal and state laws to go and find children with disabilities and begin services with them as early as possible. Mm-hmm. And we know now by research that children with autism can often be screened, and we see early indicators of autism as early as 2 years old. And so our goal then is to get in there and make sure that they're getting the services they need early in order to have better outcomes later. And so the districts are required to post, say, on their website, or to send out information to parents stating, hey, if you have concerns, give us a call. We need to evaluate your child. Unfortunately, the fact of the matter is that the districts don't do a fabulous job of getting that information out. And so oftentimes it goes back to the parent to really dig out the information and to be persistent in going after the things that your child needs. So when we think about child find, and I did say that is a federally mandated process that schools are supposed to go through, sometimes a parent can start the process simply by calling their local school district, the special education department, and letting them know that they do have concerns about their child, and whether or not the child has a medical diagnosis, if you will, of autism, the school is still required to do an evaluation. So in other words, sometimes parents think that they need to wait until they get a medical diagnosis, and that is actually not the case at all. They can go directly to the school and request the evaluation be done through the school. Now, as I'm talking about this, I'm very aware that one of the things that we often are confronted with is that parents don't want their children labeled. Mm-hmm. And, of course, we understand. We don't like labels because we think of them as in a negative connotation. However, my personal view and what I'd like to promote today through this talk is that labels can be our best friend. And unfortunately, in the society that we live in order for parents to get what their children need in terms of services, they need a label. And that's the way it works in our world. And so without the label, you don't have access to the services that you need. So believe it or not, labels are important, and they can actually be a friend to the family. Mm-hmm. So if you think of it more as access to the professional services that will lighten the impact, of that label, then maybe parents can kind of get past that hump in the road, if you will. So I encourage you, please go ahead and seek the labels that you need in order to get the services that you need.
That makes sense.
Yeah, and towards that goal, I do want to give then some kind of insider secrets on how to get this process going and how to get the outcomes that you want in the school. And so my first insider secret is really that the squeaky wheel does get the grease, but not the screeching voice, okay? What I mean by that is it is important for parents to realize that we want to develop positive relationships with the people in the schools that you need help from. I understand that sometimes we get very passionate about our children, and we want what we want, and we go for it, but sometimes the approach that parents use causes the school, unfortunately, to be resistant. Okay, it's kind of human nature. Unfortunately, it shouldn't work that way, but I'm just advising parents that if you're able to approach school professionals in a calm manner, you're going to get further than you will if you're just screaming and screeching and calling over and over. On the other hand, you do have to follow up with the schools. So if you're not hearing back and you've asked a question, you will need to follow up with them. So you do want to be the squeaky wheel, and you want to keep your name and your child's name before the school personnel, but not in a manner that's going to set up an aversive relationship with the school. We want positive cooperative relationships. So don't be hostile or aggressive, but do be firm and knowledgeable as you approach the school.
And doesn't it make sense, Kelly, that I know we have a lot of parents. I've been on the other side as an educator as well. So doesn't it make sense to start this process as soon as possible? Because sometimes those emotions and everything else obviously build and build and build and build, and we see parents having that screeching voice when they kind of play the waiting game for a long time, and then things aren't in their court the way they want it. So to kind of start it as early as possible.
Absolutely. Don't wait until you're so frustrated and you feel like your child is falling further and further behind. We want to start the process as soon as possible, and that will then, as you mentioned, Judy, reduce the frustration that maybe the parent would feel, and therefore they would be able to have a more positive outlook towards getting the needs. But, along those lines, the second insider secret I wanted to share is that you need to talk to the right people. And so, who are those people, and why should parents know who they are? So what I want to say is most school professionals do not know the rules and regulations associated with special education services. And they may, in fact, even give inaccurate or confusing information to the parents. And so it is essential to talk to the right people. So whenever you need something, it's important to know who can say yes to you, right? Because we don't want to take a no from someone that can't tell us yes. Mm-hmm. And so I encourage parents, if you get a no from somewhere, no is never no. Keep going, okay? There's other avenues that you can try, and we can help step you through those avenues. But realize that there are people of power in the school district that can help you and make things happen for you by talking to the right people. And so, realize that the school secretary cannot tell you yes about an evaluation. The general education teacher cannot even tell you yes about an evaluation. The building principal cannot tell you yes about an evaluation. And yet all of those people may join in with a no. And so that's what I mean. Talk to the right people. Don't take no from someone that can't tell you yes. Usually in the districts, the special education director or sometimes the special education coordinator and the school psychologist each have the authority to say yes to an evaluation. Those are the people you want to talk to, the ones that can tell you yes. If other professionals pass a request to these people, then you're also likely to get an evaluation out of that. So who are those other professionals that might pass that request to these people? The general education teacher could be one of those people. But there are several other people in the district who could also help. So, for example, with autism, we know that that children with autism often have speech and language deficits. You can go directly to the speech and language therapist that services the building where your child is and ask them to screen your child's speech and language skills. If that screening comes up with some scores that are concerning, then the speech and language therapist could very well refer your child for a full evaluation. Occupational therapist can do the same thing. They look at fine and sometimes gross motor skills, but also sensory processing and behavioral regulation. Obviously, the physical therapist also. Sometimes our children with autism have some awkward gait and various physical limitations. An intervention specialist who is aware of the characteristics of autism may be able to do an observation and provide information for an evaluation team. So all of those people are important, and all of those people could be an avenue to a full evaluation. So I do encourage parents to check with some of those other professionals and maybe request a screening to get the process started.
Mm-hmm. That's great. That's great. I think a lot of people don't think about going to those other specialists, so that's great information.
Exactly.
Mm-hmm.
Mm-hmm. And those other specialists have a lot of power, and they are influential on evaluation teams. So sometimes it's just a matter of getting into the district and finding out who those professionals are and start going through that list and see if you can get movement towards the evaluation.
Great.
So once a parent requests an evaluation, obviously the concern is, how long is this going to take? Oftentimes parents wait to start the evaluation process until they're already desperate for services. And then when they start through the evaluation process, it seems as if that process is taking forever. And so it can be very frustrating. But the thing that parents need to understand is there are actual deadlines that are federally mandated and established that every school district in the United States of America must adhere to if they're a public school system. And so the deadlines are, so for example, once a parent asks for an evaluation, the school has 30 days to respond and let you know whether they're going to evaluate or not. If they say yes, they're going to evaluate, they have 60 days to do the evaluation process. So all of the professionals that need to look at that child will get their testing and their reports done and everything within 60 days. Then you hold the meeting, and if the child qualifies for services, an IEP is written, so an individualized education plan is written within 30 days. So from beginning to end, it's 120 days if the district uses every day they have available to them. That's not very common, but it does happen. But the point is there is an end, and there's a treasure at the end of the rainbow. Hang in there. It can take a while. It's not a fast process, but honestly, we don't want the evaluation to be fast. We want it to be thorough, because if it's not thorough, you will not get the services that your child needs. So we need thorough evaluation. So relax and let the school do what it needs to do a thorough evaluation for you, but realize there are time limits that they cannot violate. Otherwise, they're considered to be out of compliance with federal and possibly state law as well, and that's a problem for the district, so they don't want to get in that position at all.
Kelly, I know you're kind of going through your insider secrets, and maybe this is a little sidetracked, but while you were talking, you mentioned that parents often wait until they're desperate.
Mm-hmm.
And I know we talked previously about getting a relationship built as early as possible, but are there or is there a set of warning signs that with the autism child that would be more noticeable before we even get to that desperate stage?
Yes. Several of the characteristics that are noticeable early on include things like your child may be more interested in objects than people. You may notice even in a toddler that they tend to go towards objects. They don't tend to desire or seek out interaction with others. So generally speaking, a young child will be pulling on mommy and daddy pretty consistently. Look at this, look at that, those types of things. You may not have that with a child with autism. They may not come and interact with you that way. There are deficits in oftentimes in sensory issues. So they may cover their ears when a siren goes by, or they may have meltdowns when a toilet flushes. Things like that are unusual in terms of what you would expect that child at that age to be able to do. And so if you begin to see any of these concerns, certainly by the time they're 3, you would expect them to start doing a little bit of interaction with their peers and maybe some direct play rather than just the parallel play. If you have a child 4 or 5 years old that's still just parallel playing, in other words, just sitting down next to other children and playing beside them, but not really playing with them, then those are concerns that you will want to have checked out. So those are some of the things you might see early and even at 2 years old, and ideally we would have that child set up for special education services at the age of 3, and that's when they become eligible for special education services. So at the age of 3, services can begin. So you can see why it's important to really consider these characteristics and have the child evaluated as young as possible so we can start these services, as early as 3. Now, before that, oftentimes the states will have another program, maybe through the Department of Developmental Disabilities, that services children up to age 3. And then after age 3, they're transitioned to the special education system in the schools. So that kind of gives the general, I guess, a few of those characteristics, Judy, that they might want to look at or consider.
And I don't think parents, a lot of our audience might know that the IEP can be initiated at such a young age. So I think
exactly.
That's good to point that out.
Yes. IEPs can go into effect at age 3. And really most states have a law, and certainly in the state of Ohio, that children before age 3 need to be evaluated. They're supposed to be evaluated and transitioned to special education services at around 2.5 years old, so that by the time they're 3, they're ready to move right into those services. So,
Great.
Now, one of the things about it, and we'll move to insider secret number 3, sometimes the school will tell you that they need that medical diagnosis or that clinical evaluation as part of or prior to an evaluation being completed, or even a 504 plan being initiated. And the secret that I want the parents to know is this. The schools are not really allowed to tell you that you have to have an outside evaluation done. In fact, that's why they evaluate, right? That's why they do the evaluation. They are required by law to do the evaluation regardless of what category the child might qualify under. Now, there are 13 categories of qualification for special education services. Autism is one of them. If a school district tells you as a parent that they need the medical evaluation or a clinical evaluation before they will evaluate your child in the schools, they are required by federal and most states' law to pay for that evaluation. They contract directly with doctors and clinicians and pay those fees directly. So no money should ever come out of the pocket of the parent in order for them to get special education services. Getting special education services for your child is free, and so are the services that are provided through the IEP. They're free. So at any time, if a parent is ever requested to pay for anything as part of this process, that is inappropriate. The federal and state guidelines are, this is a free evaluation for the child, and the parent. So if the school district requires or asks as part of the process for you to go out and get your child medically evaluated, I recommend that the parent ask that professional to contract directly with their doctor to pay for that. And it happens all the time, but a lot of parents don't know that they are entitled to reimbursement or entitled to have that done for free for them. The definition of autism for special education services is similar to a clinical diagnosis, but the definition is not the same. And so I always try to explain to parents, you're dealing with two separate situations here. There are clinical evaluations with clinical diagnoses, and then there are school evaluations with educational disability diagnoses. So the evaluations you get in the school are educational evaluations. In other words, we're looking at the information with an eye towards how this impacts the child in the school setting. And so those are the things that we evaluate and look at as part of that evaluation process. The school psychologist should be prepared and able to provide the autism diagnosis for an educational disability. And any fees that are required along the way are covered by the district at 100%. And I know we're kind of needing to move along here, so I'll move to insider secret number 4. And this is one that parents seem to be very surprised to find out, and yet it's been part of the law since the beginning of IDEA. And that is that if you do not agree with the school district's evaluation findings, you can request an independent educational evaluation at public expense. So here's what that means. Let's say you've been through the evaluation process, you get to the end of it, and the district says, no, this child doesn't need an IEP. Or the district said, no, this child does not qualify under the category of autism. Okay? Under those scenarios, a parent has the right to request an independent educational evaluation. And what that means is they get to pick a private provider to redo, if you will, the evaluation so that the district then will be required to compare the results of the two evaluations and then reconsider their first findings. That independent educational evaluation is at public expense. That means the district pays for it. And as a school psychologist in a private setting, I've done some of these independent educational evaluations, and we contract directly with the district. So again, if you do request an IEE, an independent educational evaluation, that is done at no expense to the parent. So do not pay for that and then try to get reimbursed later. That's not the right order to do it. You might get a lot of hassle over that. It can be done on the front end so that the private provider negotiates directly with the district and bills the district directly so that no money ever exchanges hands with the parents at all. And so be aware that you do have the right to have an independent educational evaluation done if you disagree with the findings of the school when all is said and done.
A second opinion, if you will, as in going to the doctor. So.
Exactly, and that's exactly what it is a second opinion. And, of course, I need to just say that the district does not have to use the independent educational evaluation findings and change their mind, but they do have to consider those findings. So there needs to be a meeting where all of those are reviewed, and then the district will need to decide again where they fall on that decision in terms of providing an IEP. So, yeah, I think as I move towards the last secret I want to share with people, and, you know, I'll say as a school psychologist, you know, maybe this is, you know, right up my alley, I guess, but I just wanted to say that, you know, a lot of parents are not aware that psychological services are a related service in IDEA guidelines, and they can be included as IEP services. Now, when we talk about related services, what we're talking about is the services that the child needs because of their disability. So that could be speech and language services. It could be occupational therapy services or physical therapy services. It could also be psychological services. Many, many, many of our kiddos with autism struggle with anxiety and depression and maybe obsessive-compulsive disorder. And some of these psychological disorders can be addressed. And as we are able to minimize the impact of those things, then it frees them up for better learning, right? And so I just want to make parents aware that you can, in fact, request and push for psychological services for your child if that evaluation demonstrates, you know, a high rate of anxiety or depression or any of those other things that interfere with learning. Those can be addressed in a counseling setting, if you will. And so, you know, I wanted to make the parents aware of that so that they might decide that they want to pursue that, because certainly with the team that I work with, and I work with all those related service personnel we've mentioned, we find that oftentimes it's the psychological issues that are really hindering them or creating a barrier, if you will, to learning. If I'm too anxious, my brain, my resources are not available for learning. And so we'll get in there and reduce that anxiety and teach the child some strategies to use in those high-stress situations, and the results are that they then become more aware of the learning environment, more able to participate in that environment. So obviously I think those services are extremely important, but unfortunately often ignored by the districts and not even considered as an important service. So.
Excellent. And I think that's certainly a great point that you make, and a point that I'm sure there are so many people, both educators and parents alike, that didn't realize that scenario, and that those services were available.
Now,
go ahead.
We mentioned the e-book earlier, and I was just going to say that in the e-book, it does specify those regulations, and they're all spelled out for the parents, so it will help them a little more. They'll have a little more information and guidance, as they go through the e-book. It's more of a step-by-step for them. So I think it will be really useful, and I encourage them to download that and take a look at what we have to offer in terms of insight there.
Fabulous. I know we'll provide that link to everybody, Kelly, along with other links from our other experts, so that will be coming to their email very shortly. You have covered some excellent insider secrets, and I know parents are grabbing at a lot of that information, so we thank you so much. Is there anything else you want to kind of summarize as far as the special education services for kids with autism?
I guess just my final comment might be, don't give up. You might need an advocate. If you need an advocate, reach out for one. There are educational advocates that can help you through this process as well. And I would just say, for the sake of your children, don't give up. Keep pushing, keep trying. I know it's frustrating, but hang in there, and, in the end, the results will all be well worth it.
Great advice. Thank you, Dr. Sears. Thank you so much for taking time out of your day and out of your busy schedule and helping parents and students alike with autism. So we really appreciate you joining us.
My pleasure, certainly, Judy. Thank you so much for having me.
You're very welcome.